our phones have been a lot busier this week, mainly from Texas patients and also from patients that normally would be seen in Texas. So like, Louisiana, Alabama patients that would go to Texas for care, but can't. And so, I just scheduled a patient from Louisiana yesterday because they can't go to Texas. The other thing is that hurricane that's happening, a lot of the businesses, a lot of the clinics and stuff are kind of like hunkering down and preparing for it. And so like are closing or limiting, some of the days that they're operating or the funds available. And so we're seeing kind of a surge of people, not only from the Texas bill, but also from the hurricane that's, happening. And so, our phones have been busier, specifically with out-of-state patients. The system is already kind of rigged against them, access has been an issue even before SB 8 went into effect today. We were already seeing patients traveling out of state to access abortion care because those clinics were at capacity or we were the closest to someone 2 states away. We've been communicating with some of the abortion funds in Texas to help not only help patients fund their abortion care, but also working with some of the practical support, getting them to their appointments, discounted hotels when they get here because they're going to stay overnight. They're not going to drive back to Texas in the same day probably. And so we've definitely been making those communication networks and as well as preparing inside the clinic for what we are definitely seeing. The next 2 days are very busy for us. There's a lot that goes into having to travel out of state to access care. One, you shouldn't have to leave your community to access such a basic, a legal right, to access healthcare. But, the childcare, missing days of work, paying for, gas, paying for your meals when you're here, paying for the hotel. I mean, there's a lot of systems that in community care that goes into helping people access abortion that it's hard to find in a lot of ways. There are orgs that are doing the best they can, but we're all, they're all strapped. And so that's some of the hardest, I think, is not just, okay, great, you have your appointment, we'll see you on Thursday. It's how are you getting here? Do you have someone to drive you? Do you have a support person that knows you're traveling 2 states away?